Starting off the Means Report this time around with some sobering statistics for you. Hey everybody, I'm Brad Means, and we do thank you for joining us for this special edition of the Means Report as we take an in-depth look at mental illness and suicide. Why, you may ask? Well, all you have to do is turn on the television or pick up the newspaper, listen to the radio, and it seems that suicides are in the headlines, whether it is someone you know and love here locally or whether it's one of the celebrities we showed there right at the beginning of this broadcast. And so we want to find out why this is happening. We want to find out what causes mental illness and the stigma that is sometimes unfortunately associated with it, and help you or a loved one or anybody watching find their way out of the darkness, because the bottom line is, as you'll learn from our expert on hand today, help is always nearby. There is no need to turn off that light permanently, and I cannot think of a better person to help us walk through this difficult area than the chair of MCG's Department of Psychiatry, Dr. Vaughn McCall. Dr. McCall, I'm grateful for your time. I know you're very busy, and thanks for being here for what you do.
Well, thank you, Brad. It's a pleasure. This is a topic near and dear to my heart, and I appreciate the time to get to speak.
Why is it near and dear to your heart? Do you see a lot of people who are on the verge of suicide or who are just in the darkest place ever?
Absolutely. Not only in my own practice, but of course I'm part of a department of 50 or so faculty and 30 to 40 trainees. We are a very large mental health workforce, 12,000 mental health visits per year just in my department. And so we see lots of folks that are suffering from severe mental illnesses of one sort or another, often associated with risk for suicide. I would also add that we're not alone in providing these services. There are plenty of other outpatient services for psychiatry problems throughout the Augusta area.
All right, so you have what are sometimes referred to as expected behaviors of a human being.
Right.
Then you have the other side, which is mental illness.
Correct.
How can you tell the difference? When does it cross that threshold?
That's a great question. I would say there are two things that we would look for that help us determine when it becomes a condition of concern requiring attention and treatment. The first would be just the level of distress. And it's certainly one thing to feel temporarily distressed if life throws you a curveball like a lost job or a broken relationship, but by and large, people recover from these in short periods of time. But if the distress is overwhelming, someone is completely broken by it, and it's relentless, then that requires attention. The second would be loss of function, and if we see a person whose distress causes them to be unable to fulfill their major life role, whether that's being a homemaker or a caregiver or a spouse or a parent or someone that's part of the workforce, if they can't fulfill their role because of a psychological problem, then that by definition deserves attention.
Is there a time frame you like to look at? In other words, someone's been out of commission for X number of months, therefore they're probably in a bad spot.
Probably shorter than that, and shortly we'll spend more time, I'm sure, talking about suicide, but if someone expressed suicidal ideation as on one extreme, then that's going to need some sort of attention within a matter of hours, typically. On the other hand, if someone's social and occupational function is slipping, I would say within a week or two,
wow.
That it should be addressed by some provider, not necessarily a psychiatrist. Now, this is probably a good point to add that although I'm a psychiatrist, there are a whole range of folks in professional roles that can help address mental illness. Not only folks like psychologists who complement psychiatrists, but also primary care physicians and also primary care folks who are nurse practitioners and physician's assistants. and other sorts of nursing professionals play a role in identifying and treating mental illness.
Well, how do you know once they do have the courage to come into your office or one of those other providers' offices? Is there a test, series of questions?
So I think good news is that this, the treatment of mental illness and the identification of mental illness has taken a somewhat more scientific turn in the last 10 years. We now talk about measurement-based care in psychiatry. And so just as if you went to your primary care doctor for a blood pressure check, you would stick your arm in the machine and it would render a number. And based upon the number, some decisions will be made about whether it deserves attention or not. We have developed in psychiatry and psychology some sort of quick and dirty, self-administered paper and pencil tests that identify levels of symptoms pertaining to depression, anxiety, suicide, and so forth. And so these tests, which generate a number, give us a sense of how severe a person's problem is and whether it deserves attention at that time or not.
Do you ever turn people away and say, look, you're just going through a spot, you'll be fine?
Occasionally, you know, really, in thinking about that, which is a great question, I have patients that have bona fide psychiatry problems, and sometimes they will come to me and they will have experienced one of life's normal up and downs. We talked about maybe a conversation that went wrong with a loved one that they're sort of concerned about. And sometimes the role is to not label everything as mental illness. So this is a nuance in treatment. It's deciding which things actually are mental illness and deserve medical care, and which things maybe are just part of life's ups and downs, and with a little bit of time they sort of sort themselves out and don't necessarily require professional intervention for that problem.
What about substance abuse? I wanted to make sure we hit on that. If someone drinks a lot, if someone does drugs a lot, is that always linked to mental illness, or is that a solid warning sign?
Well, excess use of alcohol, especially when it leads to health problems and loss of occupational and social functioning, when the use of alcohol becomes a dominant theme in a person's life and their life is spent trying to find the time to use it, find the money to buy it, setting aside the time to use it and then recover from it. That's one definition of alcoholism. The same would be true for drug abuse. These do generally fall under the category of needing mental health services, but I want to emphasize that they can be standalone problems. In other words, someone with alcoholism or another addiction may not necessarily have a depression problem or an anxiety problem. You can see addictions in pure form.
Let's talk about suicide for a little bit here, now that we've learned some of the causes of mental illness, some of the symptoms of it. When it reaches the level of I'm about to commit suicide or I'm thinking of committing suicide, 100% of the time do those folks have a mental illness? Are they always linked?
I would say that at least 99% of the time I've...
the internet agrees with you. I mean, you know, it does. It says suicidal tendencies and mental illness are almost always linked.
And it can come on very suddenly. So there are instances, and we've seen this in the news recently, where it came as a complete surprise. So the question then becomes, is it possible to have a mental illness, or at least a tendency towards mental illness, which otherwise appears to be invisible, and yet can be suddenly put in motion by what to the individual would seem to be a catastrophic life event. Now tomorrow, looking back on it, it may not seem catastrophic, and there may be regret for the actions taken, but at that moment in time, the person may feel like there is no alternative. But regardless, I would say in that moment in time, when the person is contemplating suicide, we should assume that there is a mental illness at play.
Are they wired differently? Is there a disconnect there in the way that that human being is set up to predispose them to thinking that suicide is an option? You look at the celebrities, and you think, how in the world could you take your own life? You've got everything. And so my question really is there something deeper where this person can't help it? They were going to do this no matter what.
Right. So I'm going to take that just a little bit step further and say not just suicide, but Are mental illnesses always predetermined?
Right.
Are there environmental factors and so forth? And I want to give you two widely contrasting examples, which in the end my answer will be yes and yes. So on the one hand, you've got very serious, essentially chronic mental health problems such as schizophrenia and bipolar disorder, for which we know from epidemiology or public health statistics, there's a large genetic load. And to give you an example of how we know this is true, if you had a child that was born to a schizophrenic parent, and then because the parent could not take care of him because of the illness, the child is then adopted away to a healthy family. So an interesting question is, what happens to a child born to a parent with schizophrenia but raised in a healthy family? And we know that that child's risk of schizophrenia is still elevated. So they are carrying with them a genetic risk from the parent in the instances of some severe mental disorders. On the other hand, we've learned, unfortunately, from our servicemen and women that serve in places like Iraq and Afghanistan, that people that are made of pretty hardy stuff, if exposed to the worst circumstances, such as relentless war, or if we think about civilians, people that are subjected to repeated sexual trauma, that the environment itself seems to be essentially responsible for producing a mental disorder such as, in this case, post-traumatic stress disorder is, of course, what I'm alluding to.
Yes, sir.
So to get back to your earlier question, is suicide something that can be helped or not? Where does it come from? We know that suicide is derivative of mental illnesses, and so you have some folks, like persons who suffer from schizophrenia, persons that suffer from bipolar disorder, both of which have heavy genetic components. These folks can be at risk for suicide. Then you have other folks that seem to be born and made of hardy stuff, and yet, depending upon awful environmental circumstances, could develop something like post-traumatic stress disorder purely as a result of the exposure to their life circumstances, and they too can be at risk now for suicide. So unfortunately, the answer to your question is both environment, life circumstances, and genetic makeup play some role in the risk of suicide.
When we come back, I want to talk more about what veterans can do and how they could potentially be treated before the symptoms get too bad. I also want to address the issue with Dr. McCall of mental health illness in children, because that is something that is prevalent indeed when it comes to suicide as well, as the Means Report rolls on.